Anxiety in its most basic form is a natural response to stress. It's the feeling of fear or apprehension about what's to come. First day on a new job, giving a speech, or navigating to a tough conversation. It's normal to feel anxious in these situations. However, when these feelings are intense, last longer than 6 months, and interfere with your life, there might be signs of an anxiety disorder. Types of anxiety disorders. There isn't just one type of anxiety disorder, it's a whole menu of disorders, each with its own specific flavor and impact on life. Let's break them down. Generalized anxiety disorder, GAD. This is like the background music of anxiety. It's a constant worry about different activities or events, often out of proportion to the actual circumstance. It's persistent and it's persuasive. Panic disorder. Imagine feeling an overwhelming terror that abruptly peaks within minutes. This terror is often accompanied by physical symptoms like heart palpitations, chest pain, or a choking sensation. It's not just a flood of fears, it's a tsunami, coming without warning and often without clear reason. Social anxiety disorder. This goes beyond shyness. It's an intense fear of social and performance situations, where the person feels embarrassed, judged, or scrutinized. It's like having an audience boo and hiss at you, even if they're just politely listening. Specific phobias. Intense fear of a specific object or situation, such as heights, flying, or spiders. It's more than just disliking something, it's a fear that can control and limit a person's way of life. Triggers and causes. The cause of an anxiety disorder are like a complex network of roads in your brain, with genetics, brain chemistry, personality, and life events all playing significant roles. Triggers can be as unique as the individual, ranging from stress at work or school to a big life change like moving, divorce, or the death of a loved one. Sometimes the trigger is eternal, a thought or a memory that sets off the alarm. Coping strategies. Managing anxiety is not about one-size-fits-all solutions. It's about personalizing your coping strategies to fit your life and your type of anxiety. Here are some universal helpful tools. Mindfulness and meditation. These practices help center your thoughts and keep you grounded in the present, often reducing the feelings of anxiety. Physical activity. Exercise isn't just good for the body, it's also great for the mind. It helps manage stress and can reduce symptoms of anxiety. Proper sleep and nutrition. Never underestimate the power of a good night's sleep and balanced nutrition. Both can influence your mood and anxiety levels. Professional help. Sometimes talking to a therapist or taking prescribed medication is the best course of action. Cognitive behavior therapy, CBT, is particularly effective for treating anxiety disorders. Medications for anxiety disorders. Navigating the world of medications for anxiety disorders can be as daunting as the symptoms they aim to treat. The following provides a clear, comprehensive guide to understanding the various pharmacological treatments available, the roles they play, and the consideration one must weigh with medical professionals. Understanding the classes of medications. Selective serotonin reuptake inhibitors, SSRIs. Often the first line of treatment for anxiety disorders. SSRIs work by increasing serotonin levels to the brain, which can help regulate mood and reduce anxiety. Common SSRIs include Prozac, Zoloft, and Celexa. While generally safe, SSRIs can have side effects ranging from mild, such as nausea and headaches, to more severe, such as sexual dysfunction and increased suicidal thoughts, particularly in young adults. Benzodiazepines. These medications are effective in quickly reducing anxiety symptoms, but are typically prescribed for short-term relief rather than long-term management due to risk of dependence and withdrawal. Examples include Xanax, Ativan, and Valium. Side effects can include drowsiness, confusion, and lethargy, and they can impair cognitive function and physical coordination. Beta blockers, primarily used to manage physical symptoms of anxiety, such as rapid heartbeats and tremors. Beta blockers, like propranolol, are often used for situational anxiety, like performance anxiety. They are less likely to cause physical side effects, but can lead to fatigue, cold extremities, and sleep disturbances. Other medications, such as antidepressants and MAOIs, are also used in treating anxiety but are generally considered when SSRIs or other treatments have not been effective. Each class has its own side effect profile and considerations. The process of finding the right medication. Finding the right medication is a journey that requires close collaboration with a healthcare provider. Here's what the process typically involves. Assessment. A thorough medical evaluation, which includes discussing your medical history, your symptoms, and any other medications you are currently taking. Start low, go slow. Doctors usually start with a low dose of medication and gradually increase it to find the optimal dose that reduces anxiety with the fewest side effects. Monitoring. Regular follow-up appointments to access the effectiveness of the medication and adjust the dosage as needed. This is also crucial for monitoring side effects and making any necessary changes. Patience and adjustment. It can take several weeks or even longer to feel the full effect of anxiety medication. Patience is key during this period as the body adjusts to the medication. Managing side effects. Managing side effects is paramount in the treatment of anxiety with medication. Being open with your healthcare provider about any side effects you experience allows them to adjust your treatment plan, whether by tweaking dosage or switching medications. For many patients, side effects can be minimized with adjustment to the treatment regimen. The impact of anxiety on relationships. Anxiety does not exist in isolation. It weaves through personal relationships, potentially affecting partnerships, family dynamics, and friendships. Here we explore how anxiety disorder can impact these relationships and offer practical strategies for fostering understanding and support among those closest to you. Understanding anxiety's influence on relationships. Anxiety can manifest in various ways that impact relationships, such as irritability, withdrawal, or dependence, often leaving loved ones feeling confused, frustrated, or overwhelmed. Recognizing these manifestations is crucial for both parties to manage their effect effectively. Communication challenges. Anxiety can make it difficult for individuals to express their feelings clearly, leading to misunderstandings and conflicts. It may also cause someone to avoid discussing their anxiety for fear of judgment or rejection. Social withdrawal. People with anxiety may avoid social interactions to manage their symptoms, which can strain relationships, especially if the behavior is misinterpreted as disinterest. Emotional overload. Anxiety can heighten emotions, leading to more intense reactions to relationship stressors, which might overwhelm partners or family members who do not understand the source of these reactions. Strategies for navigating relationships with anxiety. For those experiencing anxiety, communication about your feelings and challenges is a step toward mutual understanding and support. Here are some strategies. Open communication. Regularly share your feelings and experiences with anxiety with your loved ones. Let them know what triggers your anxiety and what support looks like for you. Setting boundaries. It's important to set boundaries around your needs, such as needing time alone or specific triggers to avoid in conversation. Clearly articulating these needs can prevent misunderstandings. Educate your loved ones. Share resources about anxiety. Understanding it as a disorder can help others see your behavior through a more empathetic lens. Couples or family therapy. Therapy can be beneficial not just for the individual experiencing anxiety, but for their partner or family members to better understand the disorder and how to support each other. Supporting someone with anxiety disorder. If you are supporting someone with anxiety disorder, your empathy, patience, and willingness to learn about their experience are vital. Here's how you can help. Be a calm presence. Offer a steady, calming presence without making assumptions about what your loved one needs. Ask how you can help rather than guessing. Listen actively. Sometimes the best support you can offer is a willing ear. Listen to understand, not to respond, and validate their feelings, even if you don't fully understand them. Encourage professional help. Support your loved one in seeking professional help if they have not already. This can be one of the most impactful ways to help. Take care of yourself. Supporting someone with anxiety disorder can be challenging. Ensure you are also taking care of your own emotional and physical well-being. While anxiety disorder can feel like a relentless storm, understanding and addressing them can bring calm and clarity. Whether you manage your anxiety through lifestyle changes, therapy, medication, or a combination of these, the key is to recognize the problem and take proactive steps towards managing it. Remember, it's okay to ask for help. It's okay to admit you're not okay. Just like any other medical issue, anxiety disorders are treatable. And with the right support, anyone can regain control of their life. So, take a deep breath and let's tackle this head on. That's all for now. For more insights and practical tips on managing various conditions, don't forget to like, subscribe, and turn on notifications.